Good morning, students. Today we are going to learn about milieu therapy. The objectives: students will be able to define milieu therapy, enlist the goals of milieu therapy, enumerate the purposes of milieu therapy, enlist the principles of milieu therapy, explain the characteristics of milieu therapy, enumerate the indications and contraindications of milieu therapy, enumerate the advantages and disadvantages, discuss the components, and describe the role of nurse in milieu therapy. Milieu is a structured community environment that promotes healthy and therapeutic learning for patients through their interaction with other peers and healthcare professionals. Philip Fennell created a revolution that the mentally ill be treated compassionately and with understanding that it is an environment that is structured and maintained as an ideal dynamic settings in which to work with client. It includes safe physical surrounding for all the healthcare team members and other clients. The definition of milieu therapy: the psychiatric mental health nurse structures, provides, and maintains a therapeutic environment with the client and other healthcare clinicians, given by American Nursing Association in 2000. The goals of milieu therapy: it changes maladaptive behavior into adaptive behavior. It promotes early recovery of the patient. It minimizes prolongation of hospital stay to re-socialize the client and to promote self-confidence. The purposes of milieu therapy: 1. To correct the maladaptive behavior, to develop adaptive coping, to acquire interpersonal and stress management skill, to achieve client autonomy. Principles of milieu therapy: principle of fundamental respect, principle for communication, principle of self-esteem, principle of promotion of socialization, principle of creating opportunities, principle of holding responsibility for their own actions, and principle of team approach. Let's discuss the characteristics of milieu therapy. First, distribution of power. The control of hierarchy is maintained so all participants have a voice in decision making, taking input from various smaller groups of clients and staff members. Open communication. Clients and staff need to be aware of individual treatment goals to ensure everyone is working towards the same goal. Structured interaction. All staff members approach the client in a consistent manner, acknowledging specific diagnostic areas, therapy, and in shortening treatment time. Work-related activity. Clients need to choose the type of work they wish to perform. Work activity should be geared towards developing skills that will be useful in actual job selection. A variety of activities provide the opportunities to test different areas for future job interest. Communication and family involvement in treatment. Clients are kept in their usual environment, for example, a day treatment center or halfway home, and continue most of their routine activities while recovering from treatment. Adaptation of the environment to meet developmental needs. Individual must have an environment adapted to his current need. Inclusion of family members with individuals of varying ages within the treatment milieu. What are the indications for milieu therapy? Patients with neurosis, drug addiction and abuse, patients with personality disorder, and patients diagnosed with schizophrenia. The contraindications are patients with depression, patients diagnosed with mania, and patients with paranoid personality disorder. The advantages of milieu therapy: it's a home like environment and it enhances decision making, develops leadership skill, and it becomes the socio-centric approach and learns the life and think collectively with the members of the community. The disadvantages of milieu therapy: there seems to be role blurring between staff and patients, limited to only hospitalized patients, requires continuous open communication among all staff and clients. Group responsibility can be easily become nobody's responsibilities, and low client to staff ratio is seen some of the times. Let's discuss the components of milieu therapy. Daily community meetings, patient government or ward council, staff meetings or reviews, and living band learning opportunities. First one, the daily community meetings. So the meetings within the patients, how it is done. The meetings are composed of 60 to 90 patients. That is the ideal number they say. But then if the patient in the ward is only 30, it is still be held. It can be conducted. And it is held regularly for a duration of 60 minutes. And patients' feelings and behaviors are examined by other members in the group, and frank discussion are encouraged. So before this community meeting could be held, one has to see the person who is in charge, the mental health nurse, has to see about the interpersonal relationship, the trusting relationship between the patient and the members who are involved in the meeting. That's very important. Staff meeting or reviews. Staff meetings should be held following each community meeting. Patients are excluded and only staff are present. In this meeting, the staff would examine their own responses, expectations, and prejudice. So here the frank communication is happening. Each one comes with their own problems, the individual perspective of conducting of the uh, board council and the meeting with the patients and their own prejudice, etc., in order to you know achieve the purposes of the milieu therapy. So that's very important, and this really brings in so much changes within the group members in order to obtain the objectives of the milieu therapy. The last one, living band learning opportunities. Learning opportunities are to be provided within the social milieu, which should provide realistic learning experience for the patients. So may it start from activities of daily living to taking care of their personal skills development and putting them into various jobs and in vocational training related to their own, you know, talents and the skills what is being observed. The role of nurse: providing and maintaining a safe and conflict-free environment through role modeling and group leadership. So the nurse has to remind herself of the principles of psychiatric nursing, because during this milieu therapy there would arise difference of opinion, conflicts among patients, because patients are mentally still getting healthy. So nurse has to keep herself a fully equipped person so that she provides a safe environment. Sharing of responsibility with patients in order to encourage them so that in future they are confident on their own, they can do their work. Encouraging patients to participate in decision making functions, because most of them lack decision making due to reasons. So she helps the patient and encourages, motivates them so that they take decision, and that would really help them to have a good mental health. Giving feedback. Giving feedback to the patients as well as to the team members is very important to um, make it more meaningful, make it a very developed milieu therapy, or it's going towards in meeting the uh, objectives of the milieu therapy. Carrying out supervisory function and nurses ensures that clients' needs are met. So that is very, very important because milieu therapy brings in healing towards the patient in physical, in psychological, and in social aspect. And so she has to see if all the needs are met in an holistic dimension. Conclude, milieu therapy is a team approach where the mental health nurse, along with psychiatrists, clinical psychologist, psychiatric social worker, occupational therapist, recreational therapist, dietitian, and pharmacist, is committed in the treatment of mental disorders or maladjustment by making substantial changes in patients' immediate life circumstances and environment in a way that will enhance the effectiveness of other forms of therapy.